Here's a structured signal from WellView 365, powered by freshnews.ai. Healthcare digital communication is now a daily operational decision, not a quarterly project for patient experience leaders. Executive summary: waiting room screens function as a frontline clinical communication system that shapes patient expectations before any staff interaction. When screen governance is aligned with operational playbooks, messages about wait times, intake steps, and service availability update in lockstep with real workflows. This alignment reduces confusion, lowers front desk friction, and strengthens overall patient experience and satisfaction. Today's signal: operations leaders are revisiting waiting room screen management during annual budgets and patient satisfaction target reviews. They are finding that unmanaged or marketing-led loops lag behind policy changes, access updates, and service delays. This is pushing a shift towards operations-owned governance, so on-screen communication follows the same playbook staff are expected to follow. WellView 365 enables improved patient experience satisfaction by centralizing digital routing, management control, and digital delivery across end-to-end delivery paths. Why it matters? Here are 4 takeaways. First, patients form expectations about wait times, services, and instructions from waiting room screens before speaking to staff. Second, outdated or conflicting messages increase front desk friction, complaints, and repeat explanations by staff. Third, unclear ownership of screen content slows updates when policies, procedures, or service availability change. Fourth, budget and satisfaction targets are harder to meet if waiting room communication is not aligned with current operational priorities. How it works in practice? A common example is a clinic updating its intake process or wait time policy for certain visit types. Marketing or facilities still own the waiting room screens, so operations sends change requests by email or ticket. The update waits behind campaign content, staff forget to refresh playlists, and patients see messages that contradict new check-in scripts. Front desk staff then spend time correcting expectations and calming frustrated patients. When operations owns the content calendar and final approval, screen messages change in step with policy updates and staff guidance stays consistent. One practical adjustment: this week, designate a single operational owner for waiting room screen content. What to do next? Here are 4 takeaways. First, review inventory all waiting room screens and list who currently controls content, access, and schedules for each location. Second, review the last 6 months of patient feedback for comments tied to waiting, confusion, or unclear instructions that screens could address. Third, define a standard set of message categories that operations must approve, such as wait time expectations, check-in steps, and service changes. Fourth, set a recurring review cadence where operations, patient experience, and clinical leads quickly align on adds, edits, and removals for the upcoming month. Read more at wellview365.com.